Welcome to Beyond the Needle, the Aesthetics Business Podcast. Each week, I'm here to share real, actionable strategies and bring on expert guests to help you level up, attract more patients, and build a standout brand. Let's turn your passion into a thriving business together. Real quick before we get started. Now, I know this from experience, both as a business owner and as a former clinic manager. The operations side never gets easier as a clinic grows. Staff schedules, payments, marketing, all of it pulling attention away from the treatment room. That is, unless you have Gloss Genius, the intelligent system that does all of that work for you, so you can focus on the work you love and watch your revenue grow. Gloss Genius is sponsoring this episode and is giving you an exclusive code. Enter code NEEDLE at glossgenius.com for 50% off your first 2 months of their med spa and aesthetic plans. Available to US businesses only. Okay, let's get into the episode. Hello and welcome back to Beyond the Needle. Today I'm delighted to be joined by Dr. Kamran Amjed, medical doctor, multi-clinic owner and founder of Consultation Catalyst, which is the UK's first CPD-approved consultation training programme for aesthetic practitioners. He's also a Stanford AI in healthcare graduate and speaks regularly at CCR, IMCAS and Aesthetic Medicine Live, among many others. So today we're talking about the consultation side of things, the part most of you were never trained on and are just kind of figuring out as you go along. But the thing is, you can be spending a lot of money on ads, posting every day on Instagram, doing everything right from a marketing perspective, and still not seeing the revenue that you expect. And a lot of the time, the problem isn't the marketing at all. It's what's happening once the patient is actually in front of you or your team members. Kamran built a framework around this after experiencing it himself. His own conversion rate was high, but the minute he stepped back away from the clinic, the numbers dropped. And that's when he realised it wasn't about him being good at it. It was about the fact that there was no real structure behind it that anyone else could follow. So we get into all of that today. What a high-performing consultation actually looks like, why inconsistency between clinicians is costing clinics money, and what you need to have in place if you ever want to step back or scale. Before we dive into the conversation, just a quick reminder, if you do enjoy these episodes, don't forget to subscribe to the podcast on the listening platform of your choice, and do leave me a little review as well. I really do appreciate it. Okay, let's get into it. Hi, Kamran. Thank you so much for joining me today. It's so lovely to have you on the podcast. Now, for anyone who hasn't come across you before, give us the overview. Who are you? And tell us a little bit about yourself and your background and your businesses.
Yeah, hi, Emily. Thanks for having me on the podcast. So my name is Dr. Kamran. I'm a medical doctor, been a doctor now for just over a decade. Previously, I was an emergency medicine doctor in the NHS, left the NHS in 2018 to start my career in advanced aesthetics medicine. I began my career with a level 7 diploma. I went on to become a trainer in the aesthetics industry as well. And 4 years ago, I started my own clinic in Manchester, where I'm based, where I learned a lot about what I do now, which is the Consultation Catalyst training and consultancy program. I've launched a few clinics over the past 4 years. I've launched 4 separate clinics in 4 separate brands in different parts of the country. I've worked as a medical director and CQC registered manager as well. So I've got CQC compliance experience. And about a couple of years ago, I delved into the GLP-1 sector as well. So I'm a clinical lead in a couple of national GLP-1 companies. I've done some AI health tech education as well with Stanford. And now what I do essentially is my main primary focus is Consultation Catalyst, which is the aesthetics industry's first ever CPD approved sales training program for practitioners led by a fellow clinic owning CQC experienced practitioner. Consultation Catalyst essentially has 2 arms. It has a training arm where we train practitioners from, front of house all the way to therapists, doctors, etc., nurses, to effectively and ethically sell the value of their clinical skill set and treatments. And then it has the consultancy arm as well, where we advise, it's more B2B, where we advise companies, tech startups, existing aesthetic companies as well on how to integrate new technologies and grow their businesses.
Amazing. So you've got a lot going on. How did you get into the Consultation Catalyst side of things? Like, how did that come about?
Well, it naturally started when I became a clinic owner. I've been in the industry for a long time. I sort of was just like pretty much most of my colleagues. Started off just, renting a clinical space and as a one-man band. And then when I opened my own very first clinic in Manchester, a CQC registered clinic, and hired a team, and I had a team working for me, I realized that there was certainly a need for some sort of commercial training. They were really excellent therapists, practitioners, doctors, etc., but they didn't have the commercial skills to match their clinical skills. And when I sort of took a deep dive into it, I realized that they've not been trained. They've not been trained. And I was looking for something in the industry to offer them some training, like some sort of sales training in our industry. And there just wasn't any. And if there are a few sort of like consultants in the industry, great people, by the way, but when you ask them how many clinics have you ran or how many consultations you've done yourself, the answer is normally zero because they don't have a clinical background. So they have an amazing business background, but not a clinical background. So I just devised one myself. I tracked my own metrics, replicated it to my team. The team started improving their conversions and the business started doing better. So then I realized it wasn't just me who had this problem. It was my fellow clinic owners, peers, and colleagues in the industry who also had this issue. So then I developed a CPD approved course. I just sort of packaged up all of my experience into this training program, got it CPD approved, and here we are.
Amazing. So yeah, you really found a little niche gap that was needing some attention in the industry. And you've said that most clinic owners don't have a marketing problem, but they actually have a consultation problem.
Yes.
What do you kind of mean by that? And what are the biggest mistakes that you see people make in consultations?
Well, absolutely that. Most clinic owners, they've got an amazing marketing campaign. They market themselves really well on social media. And if they don't market themselves, they have a PR team or a marketing agency. There's some phenomenal marketing agencies in our industry that help market them. So that's not really their issue. Getting people through the door, for some clinics it is, but most high-end clinics, getting people through the door is not an issue or not their main issue, so to speak. It's once they're through the door, the marketing agency has done their job or the campaign has done its job, and you've got people through the door, you've got physical sort of bums on seats. And then it's what happens after that, once they're in the consultation room, and it's either the founder or the team of the founder, the excellent therapists, and they're very clinically good, but they sort of scupper the whole deal because they don't know how to convert a client ethically. And, they often get the typical objections, oh, I'll think about it, or I'm not sure about this, I need to get back to you or discuss it with someone. And then they're sort of left there thinking, well, what happened there? We're such a nice clinic, we're so good at what we do, and they are, but they weren't able to communicate how good they are at what they do. And that's what I help come in and train them to do.
I feel like a lot of people experience that issue because, with not being able to communicate that properly in consultations, because it doesn't come necessarily naturally to them. Maybe they've come from an NHS background where they've not really had to sell themselves before. What would you say to people who are experiencing that, to what kind of things can they be doing to make the sales side of things in consultations feel less icky and more natural?
Well, first of all, you have to practice it, just like any other skill. We practice our injection skills, we practice our laser, our clinical skills, but no one actually sits and practices their consultation skills. They think, like most doctors in the industry, that we know it all because we've done a medical degree. And yes, you do know it all in the clinical sector, but you don't know it all in the commercial or the communication sector. So I would say, first of all, you have to, unlearn a lot of what you've learned in the NHS. That was probably the hardest part of what I had to do. I had to completely unlearn everything. Yes, the NHS is fantastic and it served me well and my colleagues well in learning a lot of our foundation of our medical careers. And we owe a lot to it, but it doesn't translate well into the business sector or the commercial world. So you have to unlearn everything. For example, in the NHS, we're taught, it's quick consultations. You just sort of dive in and make a plan, and you don't really focus on patient experience because it's all about, especially from my side in acute medicine and A&E medicine, A&E, it's just about saving a life, right? So there's not really an experience element in that. However, in the highly competitive private sector of advanced aesthetics medicine or GLP-1 medication, weight loss medicine, you have to offer a premium patient experience. So I would say, one, unlearn everything you've learned in the NHS because it's serving you well clinically, but not commercially. And two, you really need to train yourselves in the consultation because just like every other skill, you have to practice it.
And you have said before, I think, that you convert is it 80 to 90% of your consultations yourself?
92%, yes.
92%. Oh wow, okay, that's amazing. But when you stepped back, conversion dropped in your clinic, like with your other team members. So what were you doing that your team wasn't, and why weren't they just able to replicate it naturally?
Yeah, it's a great question because I didn't know myself what the difference was between me and them in the beginning as well. I thought, well, surely it can't be that much of a gap purely because of a medical degree. Like I'm not actually doing anything medical. I'm just having a conversation. And you do not need a medical degree to have a conversation. And that's what we teach in Consultation Catalyst, that, our training program is suitable for all levels, whether you're a beginner, whether you're a medic, whether you're a non-medic. It's applicable for everyone because everyone has to communicate their value in some way, even front of house and support management team members and marketing team members, they have to communicate. So to answer your question as to what the difference was, initially I didn't know. And when I sat there with my team and I said, okay, well, let me just watch you do a consultation. I'll be in the background. And, we asked the patient, do you mind if we're just doing some training? And I would just sit there in the background and I would say, pretend I'm not here. Do what you're doing because I know you're a fantastic therapist. Otherwise, you wouldn't be part of my team. So they're an amazing therapist, amazing, practitioners. And there was a few things I noticed they were not doing, which is they weren't positioning themselves effectively to make or sell a high value treatment plan. And when I say they weren't positioning themselves, it's because were not gathering enough information. And that's when I realized that, okay, so it's not that I'm rushing it or they're rushing it. They're spending time, but they're not gathering the correct level of information that they need as a practitioner or a therapist to position themselves to make a high value treatment plan. And that's what often happens. I find people saying, they're really good at what they do. They've been practicing 5, 10, sometimes 15 years, and they don't feel comfortable making these high value treatment packages. And it's because they haven't positioned themselves. So what I do is I come in and I explain to them like, look, if you gather the right amounts of information in the correct manner, you will position yourselves to support your patients and the business.
Tell me more about that correct level of information. What does that look like? What should people be
Well,
asking?
well, I always say in the training program, medicine is an information gathering game. The person or the doctor or the practitioner with the most information wins. So when I was an A&E doctor, the more information I had about my patient, the better position I was to win. And the win in that case was saving someone's life, right? So if I just did a verbal examination, verbal consultation, that's one medium of information. And sure, I can potentially help my patient. However, if I send them for an X-ray, if I send them for blood tests, if I send them for, a physical examination, blood pressure, saturations, etc., I have more information. If I check the ambulance report before they came in, that's more information. And a lot of people, I think we all agree, the more information you have about something, the better your position to help that, whether you're a doctor, whether you're in business. The more information you have, Emily, about the businesses that you work with, the better you can serve those businesses. So I essentially just trained my team, and now I train others to open their eyes and look at the information coming their way. I say, look, there's what the patient's telling you, number one. Then you have to look at the patient. There's visual information coming your way, but you're not trained to see it. You're just asleep to it, and you're missing valuable information, which again, we can dive into a little bit later. And then there's, doing a skin scan, doing a physical examination. A lot of people, I was very surprised when I learned that a lot of people don't do a physical examination of the skin or the tissue they are treating. And I say, well, in A&E, how would you feel if, you came in with chest pains and the doctor didn't even listen to your heart with a stethoscope and they just said, oh, this is what you need, just from a verbal conversation. You wouldn't really believe in the doctor's diagnosis or treatment plan. The patient wouldn't feel reassured. So it's the same way in aesthetics medicine. Why do you expect a customer or a client to feel so sure in your plan if you haven't gathered enough information first? So that's what we train them to do. And to go back to your original question as to what's the difference between my conversions and the teams, that was the gap. I just noticed that, they're not gathering enough information. You don't need to be a medic to gather this information. You just need to be trained to do so. Once I trained the team to do so, their conversions started going up. And actually the clinics that I run and co-own with my partners and the clinics that I've trained, none of them fall below 85% conversions average as a team now.
Amazing. Yeah, that's really good. And that actually leads nicely into my next question, what you were saying about, the diagnosis side of things, because you talk about moving away from just simply asking patients, what they'd like and what they've come in for and what they're looking to improve, and instead leading with that assessment, that diagnosis, and a really structured plan that they understand. And I guess, really informing and empowering the patient in front of you with knowledge about what's going on and what's going to help and why. Why would you say that shift is so important? And why do so many clinicians still default to kind of the, standard approach of just asking people what they want and what they're looking for?
It's another great question. There's two parts to that. So why is it important? And then why do clinicians, fall to the standard protocol? Why is it important? Well, it's important clinically and commercially for your business as well. Clinically, it's important because if it's your treatment plan, you need to back yourself, right? You are taking control of it. If things go wrong, the patient isn't going to share 50% of the complications with you. The onus falls entirely on you as a practitioner, as a clinic owner. So it's 100% your responsibility. If that's the case, then it's 100% my plan also. Of course, I will make a plan and my team will make a plan that completely complements the client's lifestyle. So it's got to work for the client, but I need to be confident that it's going to work on the client, on the patient. And the analogy I use is if you go to a cardiologist with a heart problem, and after the cardiologist has gathered all of his information, he's sent you for an echocardiogram, an X-ray, an ECG, etc. He's listened to your heart, your pulse, he's felt everything. And he's determined after a thorough examination and information gathering that you require 3 stents. He's going to tell you, listen, you're going to need 3 stents, right? He doesn't ask you, well, would you like 1 stent or 2 stent or 3 stents? Just like in our industry, I don't do 1, 2, 3 areas of Botox, right? I tell you, like, what's the result you want? I'll tell you what you need. So we train people to shift from the treatment onto the result. If you go back to the cardiology analogy, the result that people want is a healthy heart without chest pain, right? So the cardiologist will tell you, you need 3 stents in order to achieve this. And the same way, me and my team and the hundreds of clinicians that I've trained, they are now trained to take lead and back themselves. I say, look, you're the expert. You've spent years in medical school. You've spent years in doing your level 4 to 7. Back yourselves. You're the expert. They've come to you for guidance. And again, they don't position themselves to back themselves. So I say, gather the information, and then you will believe in your own plan. And so, yeah, clinically, it's really important because you end up getting the results and you avoid underwhelming results. You avoid complications. And again, if a complication does occur, you're best positioned to manage that complication because you're taking lead on the plan. Commercially is very important as well, because then you can scale a business. It's very hard to scale a business when you're leaving, the entire treatment plan at the mercy of how your customer feels on the day. It's like, okay, well, some people might want 3 areas. Some people might want 1 session instead of a course of sessions. But when we know that, okay, our plans are sold as a treatment for the result, it's a lot easier to manage and forecast where the business is going. And then the second part of your question, which is why do I think people fall to the sort of normal default, way of doing consultations where they ask the patient and take the lead? I think it's because it's that's what they've been trained to do. It's the status quo. They think it's normal to ask a patient in our industry, well, how many areas do you want to be treated, or how much mill or filler do you want? And I find it absurd, to be honest, because it's quite contradictory if you think about it, because a lot of these amazing practitioners in our industry, they come out and they advertise themselves as doctor-led clinics or, medical aesthetics. And they are, right? They're insured. They've done their level 7, they're GMC or GDC registered. They're fantastic practitioners. So then I say, well, why don't you run your business and your treatment plans like the person that you're advertising yourself to be? Because you wouldn't go to a cardiologist and say, hey, I want 2 heart stents. He would tell you, and same way you should tell the patient what they want, but the only way you can tell them what truly works is if you've gathered enough information in the first place.
Yeah, it's so true when you think about it like that. And I think a lot of people listening will be having that kind of light bulb moment and wondering why they've never thought about it like that before. Because it's true, you wouldn't go to a GP or any type of doctor in any other industry and request a specific treatment. You'd get the diagnosis and be led from there.
Absolutely. I always say, look, the skin is an organ, right? Just like the heart, the liver, the lungs, and we've covered the analogy already of the cardiologist. But if you're treating an organ and they're taking lead on it, you should also take lead on treating this organ that we are treating, which is the skin. It's a very important organ. Surface area wise, it's the largest organ after the muscles. and, we should take it seriously.
Yeah, absolutely. So tell me a little bit about what you would say a properly structured consultation should look like from start to finish, and what are the defined stages and why does each one kind of matter so much?
Well, we cover it in a lot of detail in the 6-hour training program, so I won't be able to cover it all. But just on a sort of high level overview, the way we position it, and there's no specific way, right? The beauty of the way we train people is we say do it in your own way, with your own personality, with your own touch on it. We don't have to do it my way because everyone's different. Your practice is different, your customer base is different, your style and personality is different, and it should be genuine. But I think a few fundamental things, no matter what order you do it in, should be communicated across to the customer and should be gathered from the customer. So we always start with a really strong introduction. People like to know who they're buying a treatment from, who they're doing business with. For example, like I'd like to know, when we're purchasing something, like we like to know what company it is, what the brand's about, the ethos of the brand, the background. So I always start with a really strong introduction. I always say to everyone, like, people need to know how good you are, especially if they're trusting you with their face or with their health or some aspect of their health. Start off with an introduction, introduce your brand, introduce your clinic as well, the other services, because a lot of people, they don't know. They come in for one treatment and they have no idea that you offer a lot of other treatments. And I think a lot of people just assume that the patient has checked out the website and they checked out how many awards they won. And I just think it's quite ignorant to think that people know you as well as you know you. They don't. So speak to them as a complete newbie, because that's what they are. They're completely new to your brand and your clinic. Then gather the information. And again, we cover this in detail, but everything, the more information you can gather, the better. We cover things like lifestyle factors, health factors, of course, physical examination. We do a skin scan, have a scanner in every clinic because that's an important part of information. Just like in A&E, it would be very hard for me to do my job without sending people for CT scans or x-rays. Imagine deleting that form or area of information gathering. So having a skin scanner in this day and age is paramount, I believe. And then once you've gathered the information, physical examination, everything, then we teach everyone to relay it back to them, because the patient needs to know that you've actually listened. And then once we've relayed it back to them, we then make the plan. And that's where we take lead and we say, right, based on all of this information that we've gathered, this is what you need. I know you need this because I've just spent the last 30 to 45 minutes getting to know you, doing a physical examination of your skin, scanning your skin with our AI scanner. And now I'm confident as a practitioner, whether you're a therapist, dentist, doctor, nurse, that this is what you need and this is what's going to work.
Amazing. And what would your approach be if you got pushback from the patient in terms of the treatment plan and like budget and things like that? How would you kind of redirect them back to it in an effective way?
Yeah, so we do have a chapter in the training program called objection handling, how to, and again, you have to be trained to handle objections. Number one is, if your consultation is as good and as structured as it should be, your chances of getting objections are very low. So we don't get a lot of objections because we spend the majority of the consultation listening and gathering information. So when I make a treatment plan and I know that this is going to complement it's going to complement the patient's lifestyle needs, family commitments, travel commitments, budget commitments. I've already gathered all of that information to make a plan that complements their budget commitments, family commitments, travel commitments, working commitments, social commitments. So because I've done that, the chances of, or we very rarely get objections because of that, because we spent so much time listening. However, if there is still an objection, and it may not be any of the things I've just listed, it may be pain. Maybe say, okay, doctor, this works for all of my budget, my family commitments, travel commitments, etc. But the pain is too much. And then again, we will say, okay, well, then let's explore some alternative options. But you have to have that ready. So again, the best way to avoid objections is to listen so well in the first place and gather enough information to make a plan that's going to complement your patient's lifestyle in the first place. Objections only occur when there's an element of the treatment plan that doesn't complement the patient's needs. And if you focus on the patient's needs so well, the chances of you getting an objection is very low in the first place. And if you do have an objection, go through the answer, I promise you, is within your consultation notes. You've missed a question. You've probably missed asking them about, maybe it's logistics. Maybe you have a single parent who needs to arrange childcare. That could be the objection. You know what, doctor, I can't come in every week. Can we find me a treatment that allows me to come in once every month? Sure, let's do that. So to find out what the objection is, I would just ask more questions and gather more information on that objection.
Yeah. Yeah, so true. I think people make it a lot more complicated in their heads than it actually needs to be. Do you have a kind of follow-up process that you recommend if someone goes away, with their treatment plan after the consultation, and then they don't necessarily book in, say a few days go past, they haven't got back in contact with the clinic? At which point would you say is the right time to kind of step in and follow up with that patient?
We have a very robust follow-up protocol that we again teach and share in the program. I never try to close someone on the day, personally. Right. And I don't expect my team to as well. Personally, when I got the training program CPD approved, the way I measured my 92% success rate was it's a very vague term, conversion, because what's a true conversion? If I see someone today, in the city center and recommend them to come to my clinic and get a treatment, and a year later they came, is that a successful conversion? Technically, yes, but very hard to measure that metric. So when you're measuring metrics, you have to, first of all, define what the metric of success is and then put a timeline to it. That's how you measure anything. And you can only improve what you measure. So the metric for success in our clinic, or when I was devising this training program, was a successful conversion on the day or within 7 days of that consultation. So I allowed a 7-day window. And if anyone converted within that window, that would be tick a conversion. Some people convert after 2 weeks, and that's fine, but I just wouldn't measure it. And if we did, probably the conversions would be even higher. But I think a realistic timeline is 7 days. It's a nice time for the patient and the client to process the information you've shared with them. There's a lot of information being shared. You've gathered a lot of information, and then you've given a lot of information. Not everyone is able to close on the day. We have clients that spend £4,000-5,000 plus within a 45-minute consultation, no problem, right? Then we have people that need to think about it for a £200 or £300 treatment, and that's absolutely fine. I say to the team, you don't have to, you are never going to get pressured from me as a clinic owner to close on the day, right? However, yes, you do need to follow them up. And if by 7 days they still don't want to, we say, thank you very much. When the time is right for you, okay, we'd love to welcome you back. And the patient really enjoys it. The team really enjoy this work because they don't feel pressured from above to close a client on the day. And I've seen, because I've trained loads of clinics, I've seen them try to pressure their team and their staff to close on the day. And I never advise it because, one, the team feel pressured. And when they feel pressured, it's very difficult for them to hide that pressure. And it does convey to the patient. So it actually ruins the patient experience as well.
Yeah, that's so, so true. And it breaks down the trust, I think, because I think especially British people, they don't want to be like, they don't want to be sold to. They don't want to feel pushed into anything. So yeah, I think that's really, really important. And actually, I think a lot of people are worried that if someone doesn't commit there and then, they'll walk away and just forget about you. But if someone's taking the time to come in for that consultation, and people don't have time to waste these days. So
well, exactly that. And look, we do train front of house teams to support with the follow-ups. We don't do it in a pushy way. A lot of companies out there, I mean, I get email marketings from, all these like for example, Suit Supply, right? Where a lot of guys get their suits. Suit Supply email me sort of like every other day. And I kind of look forward to their emails, right? I like it. But my point is how much is too much? A lot of these corporations are doing a lot, and they, because they're in the private sector. If you're going to feel bad about following up someone, then, it's going to be very hard for you to run a business. And also, this is why I spend a lot of time in the consultation. When you follow up someone robustly after a 5 to 10 minute chat, then that feels pushy. But I've never had anyone in my clinics complain about the follow-ups because we only follow them up 3 times within 7 days, right? And 3 times within 7 days. And it's after a 45-minute to 60-minute sit down and conversation. So we've already built that rapport. And all we're doing is we're just saying, hey, would you like any further information or the thing that you wanted to think about? Can we support you with, whatever it was you wanted to think about, whether it's the price, whether it's downtime? So we just offer more information to help them make an informed decision. And if by the 7th day they say, you know what, I still want to think about it. I thank you. I've got all the information. And sometimes they need to move some logistical things around, diaries, holiday. They've got, special occasions that they need to factor in. We just say, fine, we've given you as much information. If you need any more to help you make an informed decision, please contact us. We'll be happy to get back to you. And then, but we've already built that relationship with them. And once, when you do a follow-up after a 60-minute consultation, all of our consultations are 60 minutes, right? No one minds. They only mind if you don't know them and you keep pestering them a week later and you don't even know me. You spent 5 to 10 minutes talking to me. And now you just after, and that's when customers feel like it's a sale and they're being chased for it. But once you've built a 60-minute rapport plus, by the way, sometimes we're having a conversation with the reception team outside, then it doesn't really feel, it just feels like, hey, we're just doing a friendly follow-up type thing. And, we'll leave it to them. And like, another thing when it comes to sales, you can't sell to everyone, right? You shouldn't want to sell to everyone. You should only want to sell your treatments to a select cohort of clients that genuinely need your treatments. This saying that, oh, when people say I can sell ice to an Eskimo, one, I think that's highly inefficient because you're selling something to someone who doesn't need it, right? Secondly, it's unethical because why would you sell ice to an Eskimo? He has a lot of ice around him, right? So, I don't want to sell to everyone. I only want to sell to people who genuinely need it. And if they don't need it after 7 days of considering, and they feel like, what, actually, I don't need this treatment. I'm happy with the way things are. Great. We don't want to sell it to you. We just want to help you because helping you is what's going to help our business.
Yeah, that's so true. If they've just gone away and decided that they don't want to have the treatment, you probably wouldn't want to treat them anyway because that's going against your ethics and,
Exactly. And also, you're only going to end up with a clinical situation that's going to lead to undesired results, complaints, complications. And every minute you spend on managing those complications and complaints is a minute you're not spending on a new consultation or someone who does want your treatment and need your treatment, or it's a minute that you're not spending on growing your business for clinic number 2. So it's actually highly inefficient to try and sell to people who don't need it.
Yeah, and are being quite clear about the fact that they don't need it and they change their mind. Just in terms of consultation payment, I'm guessing you recommend that clinics charge for their consultations.
Absolutely. Especially if you're going to do them properly, like how me and my team do them, high value consultations, 60 minutes, sharing your level of expertise, making a plan that truly works for them. It's going to work on them. It's going to work for them based on the information you've gathered. We charge £100 at least deposit. In some London clinics that I consult for, they charge even more. And I say you should. One, it filters out people who are time wasters, right? Because again, like I said, you do not want to be, I don't want to do 20 free consultations. I want to do 5 high value consultations of people who genuinely have been vetted and need the support and the value that my clinics can offer. That's what I say to people. I said, why would you want to do 20 free consultations and just chance it? The reason we have such a high conversion rate isn't by mistake. It's because we select the people, the front of house team that we have been trained to price prime them, vet them, say, look, just to let you know, we're so looking forward to welcoming you. Our hair restoration treatment protocols range anywhere between £3,500 to £5,000 plus. Now, if someone has heard that big number, has pulled out their credit card to put down £100 deposit, that is a serious client who genuinely needs some support. They've not been scared off by the big number. Even despite hearing that, they've asked a few questions. Front of house has been trained, like how long does a consultation take and how long are the appointments? And they say, yep, it's all up to the doctor's discretion. Here's our process. Here's what we do for you. Here's what will be included in your consultation. And if you do move forward with the treatment on the plan, if the doctor deems it safe and effective for you, the price is redeemed off the treatment plan. So it works out being free. And if it's not, then at least you're protecting your time and your business's time.
Is there any instance where that consultation fee would be refunded?
No. Only if they don't turn up for it and they've given enough notice. So we have a 48-hour, and I think in my Midlands clinic, we have a 72-hour notice period because we're that busy there now. But generally speaking, there's a 48-hour notice period. So yeah, if they've given 48 hours notice to the team and they've cancelled their consultation, not turned up for it, then absolutely they get a refund. But if they've come, they've taken we've allocated the time, we've shared our expertise. We've never been asked for a refund after a consultation, even with people who have not gone forward with the plan, like technically non-converters. They've then said, yeah, you know what? This has been a really insight. I've learned a lot about my own skin health, my own hair health, etc., my own body. This was really insightful. And yes, okay, this isn't the clinic for me because of budget or logistics or whatever it may be, but they've left there with some value. And everyone has said this has been a very thorough consultation, not just by me, but by my team. So the only time refunds have been offered is if people don't turn up.
Yeah.
And that happens. That's fine.
I mean, something no one tells you is the better your business does, the more time it takes to run it. More appointments and more locations end up meaning more hours spent on scheduling, charts, follow-ups, and marketing. Instead of time with your clients and staff, let alone your family and friends, there's a better way, where you keep growing and get more time back. Gloss Genius is the intelligent system that handles more of the work for you. Scheduling, payments, charting, marketing. staff management, and client follow-up, all automatically working in the background to fill your calendar, grow your revenue, and keep clients coming back. Over 5,000 aesthetic practices already trust it to run their operations so they can focus on their vision. Ready to earn more and actually get your time back? Use code NEEDLE at glossgenius.com for 50% off your first 2 months of their med spa and aesthetic plans. Available to businesses in the US only. Okay, now back to the show. People listening, and this is something I hear all the time, people say, I know I should be charging for my consultations, but I'm just scared it's going to put people off, and my inquiry rate and my booking rate from new patients is going to drop. What would you say to those people who are like currently in that mindset?
Yeah, that was me as well. That was me in the early days. So I completely understand and, can sympathize with that. But I would say, after having, once you cut your teeth in the industry and you've run a few clinics and you realize actually it's quality over quantity. One of my favorite sayings is proceed as if success is inevitable. Okay. If you drop your consultations inquiries by, implementing a deposit structure, where you're charging for your consultations, naturally, of course, your inquiries are going to drop. My sort of advice would be just be prepared for that and be happy, because the people that are dropping are the people that are not your clients. You're trying to sell to people that are not your customers. A lot of clinics, they don't even do demographic research. They don't know who on earth they're selling to. They're just trying to sell at random. We have a very targeted approach. We don't want to sell to everyone. We want to sell to people that can, one, afford the treatments in our clinic. And when I say afford, I don't mean just financially. I mean, they can afford the downtime. They can afford to travel into the clinic. They can afford the whole process, so that's number one. And, if the inquiries drop, they drop and then you should back yourself and definitely be trained. So the few that do come in, they're your golden ticket clients, and you should be trained to absolutely offer a valuable consultation for them.
Yeah, I love that. So, it's almost, you just need to think about it slightly differently. Yes, the inquiries might drop, but the people that you are getting are more of the right people and less of the time wasters. They're less likely to come in, take an hour out of your diary, get loads of free advice, and then not come back again or buy anything.
Exactly. And look, the example I always give is, let's look at Spire's Hospital, right? It's a private hospital. They charge a premium for their consultations and their sort of bookings, and they should. It's a premium establishment. You're getting a totally different experience to most NHS hospitals, and they know what they're doing when it comes to. They know that they don't want to treat every patient, and that's fine. We're not saying every patient doesn't deserve support and treatment. They're just saying that's great, but we're not an A&E, and if you have that issue, please go to the NHS. If you want to pay a premium and have a different experience, they're the people that they're targeting. So there are a number of people out there. Everyone deserves, medical aesthetic treatments and, skincare treatments and to boost their confidence in it, etc. Fine. But, make sure that they belong in your clinic. I've consulted for many groups, laser clinics, therapy clinics. They have a different cohort. They're in a shopping center because their cohort of patients is walk-ins. They want those and they're very accessibly priced. That's great. But if you're running a premium clinic and you want to charge a consultation, you're going to see a different cohort of patients. And that's why your inquiries are going to drop. But you also will start attracting different cohort of patients, higher value ones. I think you should definitely charge for your time.
Yeah, absolutely. I totally agree. Just going back to the execution of the consultation for a second, you've mentioned transition points within a consultation. What are those, and why do consultations typically break down on them, and how do you train a team to handle them consistently?
Yeah, so this is the framework we teach exactly in the Consultation Catalyst training program. There are sections. I mean, I've loosely just covered them before, which is your introduction, then there's an information gathering phase, and then there's an information sharing phase. So if I had to really, really broadly summarize it, I'd say there's 3 sections where you do an introduction, you gather the information, and then you share the information of a treatment plan. And that's all a consultation essentially is, if we look at it in any sector of medicine, right? Whether you're a cardiologist, like I mentioned, a plastic surgeon, or an aesthetics medical professional or practitioner, you've got to say who you are, what your practice does, gather enough information to position yourself to support, the patient in front of you, and no matter what kind of patient it is, private, NHS, whatever. And then give enough information so that they can make an informed decision. That, is this going to work for me? Right. And that's often what happens. Like sometimes it's the last section where they've got a solid treatment plan and they haven't communicated it effectively. and given, and I just say to people, I say, put yourself in the position of your client. Do they, if you were your client, have you given that client enough information to part ways with 4, 5, 6,000 pounds? You know, when someone goes and buys a car, they, generally speaking, will test drive the car, they'll gather enough information, they'll look at the fuel consumption, etc. Once they have enough information, they say, okay, you know what, I'm happy to buy this car. Same way in the treatment plan, give the information. So they're my three sort of overall. There's multiple in there that we cover in depth in the training program, but overall, I'd say they're the sections. The transitioning, the reason I subsect them is, one, is really important for the practitioner that we train to know which part is when, because on the information gathering side, you need to be a very good listener. I see a lot of people just interrupting the client. They'll ask a patient a question and then they'll interrupt them mid, and I'll say, you're in the information gathering stage right now, right? Identify where you are in your consultation and just shut up and listen, right? Because the more you let them speak, the more information you have. Sure, you can help guide them because patients sometimes go off track, but help guide them keeping within your consultation lanes. Then once you've gathered it, it's very important that the patient understands that, right, okay, it's our time to speak now. We're going to tell you what to do, right? We're going to tell you what to do confidently, clearly, and concisely, because we know over the last 45 to 60 minutes, we've gathered in so much information from you. We know this is going to work on you. And then the final question really is, does it work for you? And often it does, because we're making a plan that complements not just their clinical needs, but also their social and family commitments, etc., and budget commitments.
You've done the Stanford AI and healthcare program, so you've clearly got an interest in AI. Do you think there's anything in terms of AI in the AI world that could come in the future to help streamline the consultation process or make it easier for practitioners to carry them out? Like, because I'm guessing, in consultations, practitioners spend a lot of their time making notes. Is there anything that you think practitioners could be doing right now, utilizing AI to make that process easier?
Yeah, it's already here, by the way. It's not even in the future. We're already using AI in our consultation. So as I mentioned about the information gathering part of the consultation, one part is scanning. So I have an AI scanner in all of my clinics. We bought 3 of these Aura scanners. They're amazing. I'm not sponsored by them. I don't, have any sort of ties with them in that regard. But I just bought them because they are so useful in gathering information, and it uses AI technology to gather the information and make a 3D digital twin. And you can actually show the patient what you're going to look like after the procedure in real time. Like, you can scale it and it like changes the shape or reduces the wrinkles. And, so essentially it's making a projection of where the end result is. So we're using AI in the imaging section of the information gathering of a consultation already. And we're using AI in note taking. So there's many, many apps, as you know, like I think even Paboo and Zenoti are implementing AI in the CRMs that most aesthetic clinics use. But I would say generally, yes, it's streamlining it. It's just very important to keep the human element though. So I did write an article on this I forgot which journal it was now. They're going to absolutely kill me for this. But it was the JRAM. So it's Journal of Regenerative Aesthetics Medicine, actually. Yeah. And I wrote in there the sort of implementation and utilization of AI in our practice and our field. You should use it as a co-pilot, not an autopilot. So use it as a co-pilot, make sure you're still taking lead in the consultation, but absolutely use it to support you. Just be very mindful that it shouldn't take lead in your decision-making. You shouldn't let the AI make your treatment plan for you. That's the part that I would be approaching with extreme caution, because some of the technology I'm seeing coming out, it is going to recommend it, because it's quite easy to do so if you think about it. What is a treatment plan? You gather enough information, you recognize patterns, and then you form a treatment plan based on those patterns. That's what GPs do. It's pattern recognition, right? So AI is phenomenal at pattern recognition. We already know this with radiography and radiology. Radiologists are very, their jobs are at risk at highest. My radiology friends are extremely nervous about this because no one recognizes patterns better than AI. And reading a scan essentially is pattern recognition. Same with making a treatment plan. You're recognizing patterns in symptoms, in sort of, clinical presentation, and you're gathering the information, connecting the dots, and then making a treatment plan. But when AI starts to do this, it's just very important to keep the human element because of what we do. It's people's faces, it's people's hair health, skin health, body health. And it's a very intimate, sector of their life. And so it's very important to allow AI to guide you, but not to make the decisions for you.
Sure. Have you seen a difference in conversion rates since introducing the Aura? I mean, I've heard amazing things about the Aura. I've worked with people who have an Aura device. But I'm guessing it's like, it's different to what any other skin scanner has been able to do, up until today. And obviously, like you say, you can literally show patients what the end result is going to look like before they've even had a treatment. Have you seen that make a difference in people's decision making when it comes to actually confirming whether they want to go ahead with the treatment plan?
Absolutely. Yeah. I think, well, because I always track my metrics. I think we've increased the patient satisfaction and definitely the conversions by, I think it was 12% on average across the three clinics. So I've bought three of these devices in the last 6 months, right? Just two recently from the conference in Malta. So I know the team really well. The team's really great. The device is really great as well. And when people ask me, because I get called as a consultant advisor, like, hey, which devices should we buy? Which scanners should we buy? The reason I always say you must buy a scanner. So I'm, of course, going to recommend the one that works for me in my clinics, which is the Aura. But at least buy a scanner, even if you don't buy that one, because the analogy I use is of a sat nav in a car. So imagine I ask you to drive from Kent to Manchester and use your sat nav, but your sat nav is only going to give you verbal instructions the whole way. Guaranteed, you're probably going to get lost. You're probably going to miss a turn or miss an exit on a roundabout. Even I would, right? And if you're like me, you're probably following the image on the screen. You're just following the blue line until you get to your destination. So you need visual cues. The same way, think of it from your patient's point of view. It's a communication training program, right? The Consultation Catalyst. I say to them, when you're in this third section, when you're giving as much information, if you're giving that information verbally, especially with regenerative aesthetics, like you may know, I sit on the board of the Regenerative Aesthetics Medical Institute. So I know regenerative aesthetics really well. And when you're selling regenerative aesthetics to the clients, this is it's a very slow treatment progress. Polynucleotides, exosomes, sculpture, Julane, all of these sort of biostimulators, you do not get the results straight away like fillers, right? It's going to be months. Now, coming back to the analogy of the sat nav, if you're asking someone to take a journey from Kent to Manchester only verbally, they're going to get lost. Imagine you're now trying to sell this 3 to 6 month treatment journey verbally only. Of course, they're not going to buy into it. Of course, they're going to be a little bit lost. However, if you use the Aura or an imaging device, a scanner, and present like, hey, this is how you're going to look in 3 months, 4 months, 5 months, 6 months, you're now displaying visually the journey that you're asking the patient in front of you to invest thousands of pounds into. So, that's why I love the Aura scanner device. And that's why I think it's paramount that all clinics have some form of a scanner, because it's not just to help you gather information. It's also to communicate the information back to the patient in a way that they will understand, just like you will understand how to get from Kent to Manchester by not just listening to verbal instructions, but looking at the screen in your car.
Yeah, yeah, it's so true, so true. And I don't think there's anything more convincing than being able to see the results in front of you and what you're
Exactly.
going to achieve, Yeah, I love that. On the other side of the AI thing, I have to ask your thoughts on this because I'm hearing a lot of practitioners say at the moment that they're getting patients coming into them, for a consultation, and they have given a picture of themselves to an AI tool like ChatGPT and said, what treatments do you think I need to look better or to look less tired or whatever? And then ChatGPT is giving them a list of treatments, and the patient is literally going to the practitioner with this list of treatments to say, this is what I think I need, this is what AI is telling me that I need. What would you what would you say to that? What would you say is the best way to deal with that?
Yeah, well, I've not had that yet, thankfully, but if I was to experience that, I've heard of people that have, but if I was to come across such a situation, this is where the introduction is so important, right? I would definitely say, look, before we begin, this is my background, this is what I do, because you need to state your sort of clinical authority in that situation of why you are better positioned than an AI tool to make that decision. Now, an AI is just looking at a photo, one piece of information gathering. What I would say is, hey, look, I'm going to scan your face with my AI scanner. I'm going to do a physical examination. I'm going to feel the tissue. This is something ChatGPT can't do right now. I'm going to factor in all of the other things. So you've just shared an image. I've asked about your sleep health, your diet, your allergies, your working out routine, et cetera, your sun exposure. These are, so what I'm going to essentially explain to the patient who does such a thing is say, look, that's a phenomenal plan on the limited amount of information you've shared with ChatGPT. My job as your doctor or practitioner is to gather more information, physical examination, etc., scanning, visual, inspection as well. And based off of the extra information that I have that ChatGPT doesn't have, right, this is the treatment plan that I recommend. And I think patients would, that's just logical sense. Patients would say, yeah, actually, you know what? The recommendation that this AI has made for me is based off just an image, right? Whereas the the treatment plan that Dr. Cameron and his team have recommended for me is based on 5 metrics of information gathering.
Yeah, I love that. I think it's scary that that's happening, but if you deal with it exactly like you've said, the patient would leave the consultation and completely have forgotten that they ever had that conversation with ChatGPT.
Yeah, it's just about positioning yourself, backing yourself, and taking lead
Yeah,
on the plan.
yeah. Yeah, absolutely. Now, I have to ask you about your experience growing. You've got multiple clinics now, and you're not obviously present in the clinics all of the
No.
time. You're doing lots of other things, as we've established. How did you, and this is something I love to ask clinic owners once they've reached this point, because a lot of people say to me, and I've had a lot of conversations with practitioners who have come on as guests. I think the number one problem that clinic owners have is being able to step away from their clinic without it going quiet. How have you managed to
Right.
create that for yourself in your own clinics?
Systems all day long. We have a system for absolutely everything. I was one of the practitioners where I was trapped in my business, and it's not a pleasant, experience. It's not good. It's not good for you, and it's not good for your business, because if you're in the business, you can't work on the business to grow it. So, it did take a lot of hard work and, lessons learned to get to this stage. Now, as I mentioned, I've launched 4 clinics. I'm still part of 3 of them. One's a GLP-1 clinic and 2 aesthetic clinics, one in Manchester, one in Leicestershire. And you have to have systems in place. So you can only improve what you measure. So you have to track things. You have to have clear communication platforms with your teams if you're not going to be there. And also, you have to get used to the fact that a business is only a business if it can run without you. A lot of the clinics that I train, I mean, just this year alone, we're just past halfway through the year. I've had the privilege of training just under 200 practitioners, right? Through Consultation Catalyst, multiple clinic owners. We're training a big group next week, who owns 4 sites, very successful. And one thing I've learned is they can't fathom the fact that the business can and one should run without them. I said, if a business is dependent on you, it's not a business, it's just a second glorified job, right? So a business is only a business if it can run without you. And then you need to work backwards from there. Okay, well, what can I do to make it run without me? How can I empower my team? What systems can I do? So we have loads of things and this is what we teach in the final section of the Consultation Catalyst training program, is how to utilize the systems. We spend all morning training on how to sell and the value and do the consultation. And then we put systems in place to empower them. And you have to have, if you've got a front of house team, I appreciate, like, some people, they're practicing themselves, but once you do get to that stage, you need to make sure that the front of house and the back of house are working in conjunction together. You've got to have the systems in place to allow them to do so. So we use clear communication tools. You can use like Monday.com, Trello.com, things like this. You've got to have metrics that you're measuring. You've got to have team targets. It still baffles me how people do not have targets. And I say, well, how does your team know where you're even aiming? You need to we have morning meetings every morning with all of our teams, and you can have that virtually. Then we have check-in points throughout the afternoon. And, we teach this in the training program. It's called the batch communication method. It saves a lot of clinic owners a lot of time. And they just say, wow, we really, really love this stuff. So that's all I would say. It's just systems. Put systems in place. We'll teach the systems in the program. Not all of the systems work for all clinics, but what we have found, the feedback we've received is that people say, you know what, you've taught us maybe 10 different systems and 4 of them work for me right now at this stage of my career. And it's good to know about the other 6 so that once I am at that stage and I've got multi clinics, I can be aware of those ones. So it's just good to have an idea of these.
What's one system that you would say it works for almost every clinic owner or clinic that will help them, if they've got no systems in place right now? Maybe they started off, it was just them injecting, then they've grown, they've brought other people into the team, they've not really implemented any systems before. What's the one system that you think most people can benefit from?
If I have to give away one, which doesn't require any investment, doesn't require any purchase of any platform, you can do today immediately, I would just say the batch communication method is something that I've devised. And all I say is just batch your inquiries together. So as a clinic owner, you're going to get pinged all day long. Problem from patients, from staff, from new starters, etc. You cannot help that. It's your job as a clinic owner to deal with those. Okay. But what you can control is at what rate they come in. So what I've trained my team to do, and it works really well for them and for me, they appreciate it as well. They say, you know what, we love working like this, Dr. Cameron, because we can put our inquiries into sort of one batch, present it to you in the afternoon. We know we have access to you in the afternoon at 1 o'clock, because no matter where I am in the world, around 1 o'clock, I'm probably going to be having lunch. So an easy one, just a sort of quick win, I would say, for your followers is try and batch your problems. I do this with my emails, like you get inundated with emails. And I just think, well, if it's an email, it's not that urgent. If it was urgent, they'd call me, right? So I have set times in the day where I don't look at my emails. And, if it's a time sensitive matter, they would have rang me. So I just think I'll check my emails in the morning and I'll check them once in the afternoon and then maybe once in the evening, 3 batches. And then in between, I'm enjoying life, or I'm working on the business, or living. You're living, spending time with the family, which is important, because as a founder, you've got to live a little bit as well. Otherwise, you're not going to be lasting very long. You're going to get burnt out. You're going to not last very long. It's not a sprint, it's a marathon. And when you look at these founders that are 10, 20 years plus, is because they have systems in place. They realize that actually, things can be dealt with in 3 to 4 hours time. And that's why I think the batch communication method is something that everyone really loves and enjoys.
Yeah, I love that one. And the email, I totally agree with. I think it's so easy to get, especially if you've got notifications turned on and you're just ping, 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 and you get distracted from other things that you're doing. And then it takes longer to complete those tasks because you're getting distracted all the time. So I do exactly the same thing. I'll look at my emails first thing in the morning, last thing in the afternoon. And sometimes I'm not even going to reply on the same day if it's really not that urgent. But yeah, I think that's one thing that most people can do and get away with, especially if you've got an admin team of some sort that are dealing with the inquiries, which are obviously the most important thing to kind of respond to in a timely matter. Now, I also want to ask you about the regenerative side of things, because obviously you're hugely passionate about that, and GLP-1s and things like that as well. Where do you see that side of things going in the industry? And if someone's interested in bringing in kind of GLP-1s into their own offering, where can they start?
Yeah, good question. So, they're 2 separate subsects, but very interlinked. So regenerative aesthetics, as I mentioned, I'm pleased to have joined the board of the Regenerative Aesthetics Medical Institute as of this year. And they've got a great board. They're doing great things, especially with their conference coming up in November, the Ramsey conference. So it's a great sector that's growing, and it's forever growing. Like we've seen polynucleotides, exosomes, there's now regenerative topical solutions coming out, and it's only growing more and more. The challenge that people are going to face is, how do you communicate this and convince people in an era of instant, they want things instantly. How do you communicate that? Look, slow is safe, safe is good. And this is going to take time. Again, that's where we come in. This is why I work so closely with Dermafocus, because they are leading the way when it comes to regenerative aesthetics. They brought sort of polynucleotides into the country, and they're working on some really, really exciting things as well. They've got their new product, Silora Vita, but they saw this gap and they said, like, look, we've got a phenomenal portfolio of products, but the problem we're going to have is how do we convince our practitioners to communicate to the end user that this is going to take some time. These things work, but they're going to take some time to work. So the sector is going well, as long as you're aware of these challenges. And again, you can, as long as you're trained in these, whether it's through me or through anyone else, but you should just receive some sort of training to help you communicate this. But the sector is going great. And the GLP-1 sector is another one. So I've been in it since 2024. I was consulting for a company, then they offered me a clinical lead position. And now we've just opened a weight loss clinic in the Midlands as well. And that's here to stay. It's beyond just weight loss and aesthetics now. It's now, they've got this new one coming out called retatrutide. They're finding that it improves your lipid profile. Your liver enzymes are getting better. So, and then I work quite closely with Novo Nordisk as well. And when you look at Wegovy, it's even been approved it's been approved for cardiovascular risk reduction. So the GLP-1 sector, in my opinion, is going to go far beyond simply weight management. I think it's going to be about health optimization, about longevity. And, it's a really exciting space to be in. To answer your question as to how can aesthetic clinics get involved in it? It's a conversation I was having with some of my business partners actually. And you'll be surprised where a lot of aesthetic practitioners think that to be involved in this sector, they need to be doing everything from A to Z, where they're getting the consults in and providing the GLP-1 pen. And I say to them, you don't need to be that heavily involved to benefit from the GLP-1 sector. Also, a lot of people don't want to be. So there's three ways, in my opinion, that you can benefit from the GLP-1 boom as an aesthetics doctor, right? Number one, you can do it directly where you're fully immersed in it. You're doing it A to Z, where you're getting the client in, you're doing their weight loss consultation, you're providing them with the weight loss pen, and then you're supporting them on their entire weight loss journey. You're holding their hand, you're checking in with them every month, and then do a 3-month and 6-month follow-up, and then putting them on a maintenance dose. Take it from me, that's quite tedious and quite lengthy, and it takes a lot of investment, a lot of new systems, protocols, insurance, team structure, training. So it could distract you from your existing successful aesthetics business. It's an entire different business. Do not think if you're going to do that way, that it's just going to be an add-on. You have to have a whole separate team for that. And that's why, we've opened a separate clinic. It's just weight loss clinic in Nottingham. So that's one way. The second way you can benefit from the GLP-1 boom is just being linked to it. So you can get people in for a consultation and say, hey, we've partnered with a third-party pharmacy service where we're not going to provide you with the pen or even follow your journey, but we're going to begin your journey. Now, what that does is it gets people through the door. It gets people through the door. And if you've been, on Consultation Catalyst, you're now trained to upsell. So you get people through the door who came in for weight loss, but they're like, actually, while I'm here, I'd love to hear about this radio frequency treatment that's going to tighten my skin as I lose this weight. So now all of a sudden you've caught a patient that was never going to come to your clinic. They were only after a weight loss treatment, but because thanks to your amazing consultation, because you've been trained, you've now communicated to this patient that as you lose weight, you will get saggy skin, you will lose elasticity. You might want to consider some sculpture alongside it. You might want to consider some gelane. You might want to consider polynucleotides. Your hair might be thinning, all of this stuff. So that way, you're not actually providing a weight loss service, but your aesthetic business is benefiting from the GLP-1 sector by being connected with it. But you offset the supply chain and the sort of follow-ups to a third-party pharmacy, right? So I actually recommend this for anyone who wants to really dive into it, but doesn't want the headache of supplying it, because it's not easy. You have to get GPHC licenses. You have to make sure your pens are cold chained, delivered, etc. So it's a heavy protocol. So, and then the third way is where you're not even doing any of that. You're just very loosely connected to it. You're just on the peripheries almost, where you're saying, we don't offer weight loss medication. We don't even offer the consultation. We don't want to, but we're good at what we do, which is skin tightening and skin rejuvenation. And if you've had treatments, please come in after you've lost your weight or while you're losing your weight from someone else. And we're happy to support your weight loss journey from an aesthetics point of view. So they're the three ways that I think people in the aesthetics industry can benefit from the GLP-1 boom: being directly involved, half involved, and not involved at all, and just supporting the sort of weight loss, the symptoms of weight loss.
I love that. Yeah, I think a lot of people don't really think about it like that. But like you say, even if they're not supplying the weight loss injections themselves, there's going to be a lot of people out there that have lost a lot of volume, especially if they've lost a lot of weight after a certain age and have significant skin laxity. And you've got the treatments there in your clinic to help with that. So yeah, definitely something to play into. Love that. Really, really helpful advice. As we wind down the episode, one of the last things that I wanted to ask you was, if somebody has listened to this and they're they've now got all of this amazing information and tips going through their mind, and they want to do something today to start improving their consultation conversions and the way that they handle their consultations, what are the top 3 things that they can do to help start seeing an improvement?
Number one is introduce yourself. A lot of people don't introduce themselves properly. Practice your introductions. Make your introduction to a level where if you were a patient, would you believe in yourself, right? Introduce your practice as well. Number 2, I would say have a framework that you and your team can follow. Again, we teach this in Consultation Catalyst, but even if you don't come to us, just practice something yourself. Ask yourself, what information do I need to effectively support my patient? And what information would my team need? Write that down and make sure you and your team follow it. And then thirdly, I would say, don't try and convert people on the day. Give them time. Not just be aware that not everyone has the same spending cycle. Okay. Some people need 7 minutes to make a decision. Some people need 7 to 14 days to make a decision. And that's absolutely fine. Be aware of that.
Amazing. Such great advice. Thank you so much for coming on. This has been such a helpful episode. Now, for anyone who wants to learn more about you or Consultation Catalyst, where can they find you?
Yeah, so we've actually just renewed our website, by the way. So you can check out our website, www.consultationcatalyst.co.uk. I'm sure Emily will, put the links there. We're on Instagram as well at consultation.catalyst. And I'm on LinkedIn as well, and I'll share all the links and appropriate sort of communication methods with Emily. I'm sure she'll kindly share them. But yeah, happy to get in touch.
Amazing. And I'll put all of the links in the show notes below. So yeah, if you want to go and learn more about Kamran or Consultation Catalyst, just head over there. But thank you so much for coming on. This has been an amazing episode. You've been so helpful.
Thank you for having me, Emily. Thank you.